Hello everyone, my name is Pete Melrose and I'm happy to welcome you to the first in a series of audiovisual tutorials describing my trademarked Cloud Healthcare Appliance Real-Time Solution as a Service, or CHARTSaaS, its background, purpose, scope, and the meaning of the logo. Thank you very much for attending. In the spirit of full disclosure, you should know that I, Pete Melrose, am an independent information technology IT consultant to professional and organizational healthcare providers. The Cloud Healthcare Appliance Real-Time Solution as a Service, or CHARTSaaS, described herein, is my original trademark concept of an IT Integrated Development Environment, or IDE, for use by healthcare provider subject matter experts, or SMEs, in the design, development, deployment, operation, and optimization of IT applications, also known as apps, for the cognitive support of administrative and clinical use cases. I am not employed currently by any for-profit or not-for-profit organization, but I have partnered with Case Agile LLC of Sheridan, Wyoming, USA, to implement the CHARTSaaS IT principles and prototypes described in these tutorials. Quoting from the April 2011 book entitled Medicine in Denial by Lawrence Weed, MD, quote, "Electronic information tools are now widely discussed, but the tools depend on standards of care that are still widely ignored. The necessary standards for managing clinical information are analogous to accounting standards for managing financial information. If businesses were permitted to operate without accounting standards, the entire economy would be crippled. That is the condition in which the $2.5 trillion U.S. healthcare system finds itself, crippled by lack of standards of care for managing clinical information. The system persists in a state of denial about the disorder that our own minds create and that the missing standards of care would expose," end quote. This observation by Dr. Weed, a graduate of the Harvard Medical School and creator during the 1960s and 70s of the problem-oriented medical record and the subject objective assessment plan, or SOAP, method of charting, aptly describes the need that the Cloud Healthcare Appliance Real-Time Solution as a Service, also known as CHARTSaaS, is intended to meet. In addition to the motivation and examples of Dr. Weed, whose mentoring I was happy to have during the early 2000s via extended phone conversations, I was provided with a unique opportunity for healthcare information technology innovation at the beginning of my healthcare information technology career from 1968 through 1971 by the late Bernard C. Gluck, Jr., MD, Director of Research at the Institute of Living Psychiatric Hospital in Hartford, Connecticut, for whom I worked as a research associate in Dr. Gluck's capacity as principal investigator for the first U.S. National Institutes of Health funded research project to demonstrate the application of computers in medicine. Credit for implementation of CHARTSaaS goes to Boris Zinchenko, PhD, Chief Technology Officer of Case Agile LLC of Sheridan, Wyoming, USA. Dr. Zinchenko has adapted his previously developed and commercially implemented Enterprise Explorer and also his Aura expert system for multivariate adaptive forecasting to this purpose. The logo of the Cloud Healthcare Appliance Real-Time Solution as a Service, also known as CHARTSaaS, includes the staff of Asclepius, the Greek physician deified as the god of medicine, superimposed on a background of clouds. The intent of the logo is to represent an information technology, or IT, cloud-based solution for medical practitioners and healthcare delivery professionals to create and operate applications, a.k.a. apps, for IT-enabled cognitive support. These apps, developed and used by healthcare provider subject matter experts, are expected to facilitate personal health management, to mitigate medical mistakes, to improve patient safety, to optimize case management and outcomes, and to accelerate the accrual and application of new medical knowledge. In general, The increasing use of CHARTSaaS by its credentialed professional and accredited organizational healthcare provider subscribers will facilitate the sharing of the cloud-based CHARTSaaS artifacts, a combination of knowledge structure as information in a functional context as automated processes, and thereby will improve medical practice and healthcare delivery globally. Please attend other tutorials providing a functional overview of the Cloud Healthcare Appliance Real-Time Solution as a Service, a.k.a. CHARTSaaS, and an explanation of each of its 12 features at your earliest convenience. Please contact me, Pete Melrose, via email at jpetermelrose@gmail.com or phone at 001 US 612-201-2301 for further information. Thanks for your time and attention, and good wishes for another great day.